Special thanks to the people who have made the production of the American Health Journal possible.
Toshiba Medical Systems, providing physicians with imaging tools to improve diagnosis since 1914.
This program has been presented in part by Ledesma and Meyer Construction, building for a common vision.
And special support from Southern California Physician Magazine, the official publication of the following medical associations. Southern California Physician Magazine, the magazine physicians read.
And generous assistance from HF Healthcare, serving the hemophiliac community.
The American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
Thanks for joining us for this special edition of the American Health Journal. I'm your host, Roger Cooper. For this half hour, we travel to Palm Springs, California to speak with the medical director of the Aaronson Plastic Surgery Center, Dr. Scott Aaronson, who's earned a reputation as one of the most skilled, educated doctors in the field of plastic surgery. This program will feature the many facets of rejuvenating the face and resculpting the body. According to Dr. Aaronson,
cosmetic improvement in the appearance of the face involves many different procedures.
The most requested procedure is the facelift.
The facelift can make a dramatic change on your appearance.
There's an eyelid procedure known as blepharoplasty.
Because the eyes are the first area that we see when we meet someone, this is a commonly requested procedure.
Another procedure is cosmetic improvement to the appearance of the ears, known as otoplasty.
The reality is that the request may come from young children when they're 6 years old, when they start to enter the school period.
Rhinoplasty is another very popular procedure for both men and women who want to reduce the size or shape of their nose. Among the other rejuvenating procedures for the skin and the texture of the face is the laser procedure for removing wrinkles and the intense pulse light treatment that helps fade dark spots on either the face or the hands.
Using the intense pulse light treatments on the hands also can create a very dramatic result.
Included in the array of surgery options Dr. Aaronson performs at the Aaronson Plastic Surgery Center is body contouring or resculpting. The list of procedures includes breast augmentations, liposuction, and tummy tucks. Patients often seek in order to revitalize the areas of their bodies they want to improve. Now on the American Health Journal. To begin this segment on facelifts, Dr. Aaronson told us,
the facelift can make a dramatic change on your appearance. Frequently, they're requesting tightening of the cheeks and the neck region. In this particular case, the patient desired improvement in the appearance of her cheeks and neck region, and we went ahead and performed a facelift by tightening up the cheeks, removing the excess skin and fat of the central neck region. When we do the neck, in many cases, we're removing fat and tightening up the muscles at the same time as we're performing the facelift.
A lot of people would say, Anne, you look so good. Did you have something done? Or you look so natural. There's not wrinkles. I mean, what have you had anything done? And that made me feel really special that I had had the surgery.
As you age, the skin loses its elasticity and heavy jowls appear and wrinkling of the neck.
You can see we smooth out the cheeks, smooth out the neck, and this is without laser resurfacing or any additional procedures.
Sometimes Dr. Aaronson does laser resurfacing along with a facelift if necessary.
You can improve the appearance with just a facelift or eyelid procedures without doing laser. However, if the patients are still concerned about the wrinkles, then you can follow up with laser resurfacing at a later date. In many cases, we're also performing a brow lift at the same time as the face and eyelid procedures. We perform the endoscopic brow lift, which is a faster recuperation for the patient. We performed upper and lower eyelid procedure and a facelift at the same time.
I had cousins come out to visit, and my cousin kept studying me and kept looking at me And finally she said, I just have to ask, what is your secret? What is your secret to looking so young and so vibrant? And then I told her my secret weapon is Dr. Aaronson.
After seeing how great his wife looked after having her facelift, the husband opted to get his face done too.
Plastic surgery is not only for women, but it's very common in men as well. In particular, they're concerned about how their neck is. Particularly, they notice it when they close their shirt and the skin hangs over their collar. So at the time of a facelift, we're removing that hanging skin, tightening up the neck, and they can see a dramatic improvement in the area. In this particular case, this is a gentleman that desired those improvements. We improved his appearance by doing his upper and lower eyelids and a facelift. And so you can see the drastic change in his eyelids and his cheeks and neck region.
It's pretty amazing. I've yet to have anybody ask me if I've had any work done, if you will. You know, the typical comments, have you lost weight? You know, Palm Springs is agreeing with you. You looks like you're out in the sun a lot, things of that nature. I had a business colleague the other day I hadn't seen in a year said, you're looking younger every day, you know, and I laugh about those things, you know. Yeah, I think it's just a well-being appearance that seems to come across the folks.
An endoscopic brow lift procedure is typically used in reducing creases that appear and as a solution to unwanted furrows and deep forehead lines.
This next patient, we went ahead and did a similar type of procedure, endoscopic brow lift, upper and lower eyelid, and facelift. And again, you can see the drastic change in the appearance of her cheeks and neck, as well as the eyelids look much more open. What's interesting is that no laser resurfacing or any procedure was performed on the cheek area. However, there's much less wrinkling of the cheeks. So you can see just with a facelift, you can improve the appearance drastically.
Facelifts are not just for patients who are in their 60s or 70s. They can be done in their 40s and 50s and still see a dramatic improvement.
In this particular patient, she's in the younger side of the age range that the patients that request facial improvement, and you can still see an improvement when we did a facelift. You can see smoothing of the cheeks, smoothing of the neck. You can see a drastic change because we actually removed the fat and tightened up the skin and the muscles in the area.
In addition to a facelift, eyelids can also be done to give a more refreshed appearance. We'll be back to show you some of the results.
You're watching the award-winning American Health Journal.
As you age, your eyelids stretch and the muscles supporting them weaken. As a result, excess fat may gather above and below your eyelids, causing sagging eyebrows, drooping upper lids, and bags under your eyes.
Because the eyes are the first area that we see when we meet someone, this is a commonly requested procedure. In many cases, we're performing blepharoplasty or upper and lower eyelid procedure at the same time as a facelift. In this particular case, we're performing the eyelid procedure and the facelift, and you can see the drastic change in her appearance by improving all those areas at once. Particularly in her neck, we removed a lot of fat, tightened up the muscles, and smoothed out the contour in the area.
People that knew I had the surgery were just amazed at how wonderful I looked and how natural I looked. People and acquaintances that didn't know I'd had the surgery that I would run into, the predominant thing they said was, you look so much leaner, or you look so much more rested. Where have you been? Have you been on vacation? Nobody came up to me and said, have you had work done? Not one single person has ever said that to me.
Dr. Aaronson makes certain the eyes are symmetrical and natural looking, so they appear more youthful and refreshed.
This is a young woman who desired cosmetic improvement in the appearance of her eyelids. We removed that heaviness of her upper eyelids, and then we went ahead and removed the excess skin and fat and smoothed out the lower eyelid at the same time.
Besides making you look older, severely sagging skin around your eyes can impair your vision. Blepharoplasty can reduce or eliminate such impaired vision.
The next patient is a variation on the eyelid procedure where we do the lower eyelids, removal of fat, and we remove the wrinkles using laser resurfacing. This is a common procedure where you have a lot of wrinkles of the lower eyelid.
The blepharoplasty procedure improves the area around your eyes and gives you that more youthful appearance. Coming up in our next segment, laser skin resurfacing and intense pulse light for your face and hands. What is the least performed cosmetic surgical procedure? A. Buttock lift. B. Calf augmentation. C. Pectoral implant. Or D. Thigh lift. The answer when we return. Now you can take the American Health Journal with you. The doctors you depend on for instant information are as close as your mobile phone. So go to ahjmobile.com and get the latest medical information you need. What is the least performed cosmetic surgical procedure? The answer is C. Pectoral implant. For this segment, Laura Windsor reports on a minimally invasive procedure that rejuvenates the skin.
Roger, according to the American Society of Aesthetic Plastic Surgery, there were over 500,000 laser skin resurfacing procedures performed in the United States in 2010. Laser skin resurfacing is designed to remove superficial and moderately deep lines and wrinkles on the face, hands, neck, or chest. It can also help restore skin suffering from acne scars, sun damage, even age spots. Dr. Aaronson tells us what the best and most effective method used today for removing wrinkles of the face.
Many patients are concerned about wrinkles of the face, and the real gold standard for removal of wrinkles of the face is the CO2 laser. We've been doing the CO2 laser since 1995. In this particular patient, we removed the wrinkles using the laser, and we did her full face. In the preoperative view, you can see a weathered skin, wrinkles around the mouth, wrinkles of the cheek, wrinkles of the lower eyelid, and then in the after view, you can see the improvement in the color and the texture of her skin.
With laser resurfacing, the layers of skin are removed, and as healing progresses, a new, healthier-looking skin emerges. This procedure is one of the top 5 minimally invasive procedures being done today and is safe and effective. Intense pulse light, IPL, is another treatment modality that uses multiple wavelengths of light and effectively treats rosacea, vascular lesions, flushing, and age spots as well.
Intense pulse light treatments, also known as IPL treatments, are great for improvement in dark spots of the face, neck, chest, and also improvement in broken blood vessels. It's non-invasive, so there's really no downtime. In many cases, the patients are concerned about weathering of their chest area. In this particular patient, we did intense pulse light treatments of the chest, and this is usually requires somewhere between 3 to 5 treatments to get this type of improvement. Using the intense pulse light treatments on the hands also can create a very dramatic result. This patient was in her 80s and said that she wanted to have us remove the dark spots, so we did approximately 3 treatments, and you can see the dramatic improvement in her appearance. This is an example of using the intense pulse light treatments for removal of broken blood vessels of the face. This is known as a port wine stain, which is a collection of broken blood vessels in an isolated area. After approximately 3 treatments, you can see the lightening of the reddish area in front of his ear has improved, and this is outpatient, and pretty much no recuperation is necessary other than possibly a little bit of redness right after the treatment.
When we come back, a segment on otoplasty, a common procedure that improves the appearance of the ears.
You're watching the American Health Journal, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States. Watch the American Health Journal each week on this PBS station.
And now back to Roger Cooper and the American Health Journal.
Otoplasty is the most frequently performed procedure for reconstruction of prominent or protruding ears. Children are often self-conscious about how they look, especially if their ears protrude.
Frequently, this is requested by young people about the age of 6 when they start going to school and they're ridiculed by other children. In this particular case, we performed a standard otoplasty. Most of the work is done behind the ear, and this is a fairly fast recuperation.
Although most setback otoplasties are performed in children between the ages of 4 and 14, the second largest group of patients in this category would be women in their 20s and 30s.
It's not only limited for young people, adults as well are concerned about the appearance of their ears, whether it's women or men. This is an example of a woman that wanted to wear her hair up, and so we went ahead and performed an otoplasty, and you can see the drastic improvement in the appearance just by performing this particular procedure.
Rhinoplasty is a surgical procedure designed to reshape the nose. Sometimes referred to as a nose job, it can be performed to correct a structural deformity, such as a bump or a hook, or to improve your appearance by making subtle changes to nose size and shape.
Rhinoplasty, or cosmetic improvement in the appearance of the nose, is frequently requested by men as well as women. The young individual wanted removal of the hump, so we went ahead and worked through the nostrils. The procedure is done on an outpatient basis, and here she is with a drastic improvement with removal of the hump and refinement in the nasal tip.
Rhinoplasty is considered one of the most demanding plastic surgery procedures. Described by leading facial plastic surgeons as an operation of millimeters, it requires exacting attention to detail and thorough knowledge of the nose and its healing properties.
Here's another example of rhinoplasty where she was requesting the removal of the hump, and then afterwards you can see a nice improvement in her appearance.
The goal of rhinoplasty is a nose that looks natural and blends harmoniously with your other facial features. Breast augmentation that results in a look and feel that's natural after this short break. Now you can take the American Health Journal with you. The doctors you depend on for instant information are as close as your mobile phone. So go to ahjmobile.com and get the latest medical information.